Good morning, everybody.
Good morning.
All right. Good morning. Okay, so thank you all very much for being here for our first day of negotiations. We have two respondents that will be negotiating with us today. It's Q&Q and then also PCG because GW did pull out. I wanted to let you all know that we will have 40 minutes with them this morning. They will have 15 minutes of a presentation. There are 3 specific questions that they were asked to answer, so I just wanted to review those questions so you have those questions in your mind. The first question is to describe the team's ability to meet the expectations of the proposed services within the revised timeline. Do you all have a copy of the revised timeline? I want to make sure everybody has a copy of this. So our original timeline was for a 5-month program. We have expanded it over to 7 months, but we did expedite the delivery at the beginning of the program for them to be able to provide the key measures early in the process and to ensure the delivery of the expedited funding early. So those were the things that we wanted to make sure that they responded to. We asked them to include anticipated hours for the development of each deliverable, understanding that this is a fixed price contract. So that's the first thing we asked them to respond to. The second question is for them to explain in detail their proposed plan for community engagement at the neighborhood level to gather quantitative and qualitative data that's integral to the development of the comprehensive programs inventory and the gap analysis. We want them to include specific plans for subcontracts with local organizations or individuals who have flexibility towards and their flexibility towards recommendations requiring this as a part of their subcontract. The third question, can you hear me? Mm-hmm. The third question we asked them to respond to is to identify the greatest perceived risk, the top 3, and that they anticipate by committing to this project and how they propose to mitigate them. So after they present their presentation, then we can go into question and answers. We want the questions to be designated specific to the presentation that they provide. Now, I have a laundry list of questions that I want to ask them that don't have anything to do with these. We will save those questions for later in the afternoon. But let's start with questions specific to their presentations, and then if we have time, we can go into any additional questions, but that's what we want to start the conversation with them today, okay? Any questions? Are you all ready? All right, sounds good. We are ready. And if you need the microphone, let me know. I'll pass it around.
Y'all.
Can you speak to it in the microphone?
Y'all, you have this document that Neil has here with regards to deliverables.
The microphone's on. Little power button on the side. It says power. Thank you.
Hello.
Yes.
Yes, hello, negotiation team. You have this deliverables time line with you. We changed that based on the discussion at the last negotiation team meeting. You can see above is the one that was originally in the ITN. Below is the proposed new one. As we spoke with our counsel, Mr. Springer, over the weekend, we determined that it would probably be best, rather than to front load the payments, to back load them. So what you see is that all of the payments, or 60% of the payments, are done at the end, so that basically what we have is all the payments will be made for a final product. The other one above had payments for draft products. Now only the final products will be paid, which allows us to put a little bit more funding at the end to make sure the process goes as the council deems appropriate. Just wanted to make you aware of that, and that's something that will probably need to be discussed with the 2 vendors today.
Thank you.
Are we ready?
Yes, sir, we're ready.
It says 9 people are in there now.
Oh, good.
So, does that sound better? Okay, when I said 4, I wasn't sure if that was too many. Do you want to confirm all of these for me? Yes. Okay, perfect. And then you should have an advancer for your slide deck, and you're just on the microphone, you might need to press power on this, on the little button. Yep. And then, hi everyone, if you can give me just a thumbs up that you can hear. Fabulous. Everyone is joining. And I am going to turn, oh, I can't turn it off. All right. If someone gets booted out and needs let back in, just let me know, okay? Thank you. And then do you want them to see that as well?
That would be great.
Sure. Voila. They should be seeing it now as well. Yep. Yes, ma'am.
Are we able to see the 2 numbers on the screen? Is that?
When she's done with the presentation and go into question and answers, yes, ma'am, I'll adjust. I was gonna see if I could make this bit any bigger. Sometimes it lets me, no, okay.
All right, good morning, everybody. My name is Sandra Glenn, and I want to welcome everybody to the Children's Services Council of Leon Assets and Needs Assessment Negotiations Meeting. My name is Sandra, and I will be the lead negotiator for today's meeting. Just a couple of reminders. This is a non-public meeting of the Children's Services Council of Leon County's negotiating team regarding the invitation to negotiate for an assets and needs assessment. This meeting is being recorded, and the recording will be made available to the public following contract award. I'm asking everyone to please speak clearly into your microphones, including the one that we have for our negotiation team members, so we will have to pass this around. So please speak clearly into the microphones, and Ms. Sandra, I'll ask you to please make sure you also speak clearly into your microphone. Today is Monday, October the 11th, and the time is 10:12 a.m. This meeting is between the negotiations team and the Q&Q research consultants. I want to introduce to you all of the negotiation team members that are here at the table, just to make sure you're aware of who they are. Once again, my name is Sandra Glenn. We also have here in the room Mr. Neil Skeen. He is an attorney, and he is also a child welfare official. He is retired, but he brings a lot of expertise here to the table with us. We have Mr. Walter Sachs, who is right there. He is the Department of Children's and Family Northwest Regional Director. We have Ms. Carolyn Cummings, who is an attorney. She is Leon County Commissioner. And then also with us today, down at the table, we have Mr. Ted Granger, who is our Leon County Interim Administrator, the CSC Interim Administrator. We have Mr. Fred Springer, who is our General Counsel. And then we also have, I'm sure you know who she is, this is Holly McPhail, who is our purchasing official and also an interim operations manager. Please provide a brief introduction of who you are, please, ma'am, and then also please introduce the members of your team that we will see on Zoom. And then once those are done, I just have a few more things to say, and then we'll give you an opportunity to go into your presentation.
Question, will you be able to hear them or no?
Yes, yes, 100%. Can we get a test? Will one of you come off mute and just say hello?
Hello, can you hear me?
Yes, we can.
That is perfect.
All right, and I'll try to make it bigger. We'll go to speaker view, so if they want to, does that work?
Oh, that's fine. That's fine.
And since you're up there, I'm going to ask you to please remove your mask just so we can hear you. Thank you.
Okay, well, good morning, everyone. Thank you for considering QQ Research Consultants. My name is Sandra Williams. I'm going to have our team member quickly introduce everyone for us.
Look at this.
Go for it.
Good morning, everyone. My name is Dr. Lexi Balmer Rivera, and I'm here with our team. We have, of course, Dr. Sandra Williams there in person, Ms. Robin McClyman, Ms. Kelly Manning, Dr. Carla Rivera Torres, Mr. Gino Rubens, Ms. Vivian Boorkes, Dr. Patricia Warren, Dr. Stephen Ferrante, and Ms. Crystal Lachey.
Thank you, Lexi. Okay, so who are we?
I'm sorry, before we get started,
No problem.
just to remind everybody about the process that we are gonna follow today. This will be a 40-minute segment. You will have 15 minutes to provide your presentation, and then it will be followed by questions and answers based on the conversation that we have with you right now. We do plan to invite you all back this afternoon for a 45-minute session, where we plan to have a lot more questions that are specific to your proposal. So please don't leave, stay close so that we can have that session later on this afternoon. There is still the possibility of even a final session after that. After we've had an opportunity to respond to the others, we may come back with some final questions for you. So we just wanted to make sure you understood what to expect for today. Okay?
Would it be okay if I sat?
Absolutely, 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 yeah, you have on some high heel shoes, so I completely understand, no, please have a seat. All right, we look forward to your presentation, please go ahead and proceed.
Okay, well, good morning, everyone again. My name is Dr. Sandy Williams. I am the CEO at QQ Research Consultants. Who are we? We help funders like you determine how to measure and evaluate their impact in communities. In addition, equally important, we help bring the voices of community members, your parents, your leaders, your service providers to the forefront so that their lived experiences, their challenges, their barriers, sometimes their knowledge of their community, and many, many times their recommendations to the forefront to inform your funding decisions, to inform your service provisions. And so we don't do IT, we don't do facility management and evaluation and research and assessment. We're intentional about our focus. We're a niche company. We do needs assessments, research, and evaluation. And in doing so, we really try to make sure how can we bring forth the community, how can we use the data, not just the quantitative data, but the qualitative data to be able to tell the story. And so we know that you have a big decision that you need to make today. Should you go with a large company or a university that has many, many, many engagements with government entities, with funders, but minimal expertise with boots on the ground community engagement? I'm hoping that you will consider the importance of bringing the community's voice in the work. Okay, I'm going to move on and talk a little bit about community engagement. We were really excited about this opportunity because you guys are at the beginning stages, right? This is the chance where you can begin to build those trusting relationships with the community. So to come in at the beginning is exciting. You get to do it in an intentional way. You get to not bring the community at the end as an afterthought, but you're including them at the beginning. And this is what we're hoping to do with you. So could you go with PCG or George Washington University? To be quite honest, you'll likely get very high quality deliverables from all three firms. But the approach is where the difference lies. And the way we approach our work is using a culturally responsive and equitable approach. It's really all in the approach. So how does that look like? How do you operationalize that, right? So is it, just at certain stages? For us, we're doing this throughout the entire process. From the beginning, how do we enter the community? Are we just going in and telling them, we'll tell you what your needs are, and then we're going to tell you what the outcomes are, and then we're going to expect the service providers to fall in line? That's not our approach. Just like you wouldn't go into someone's house and tell them what their needs are and tell them how you're going to fix it, we don't do that. We're very intentional about how we enter. We're entering the community. We're here to listen and to learn from them as well. Okay, so for the first key deliverable, the key outcomes and measures, we wanted to focus groups with the service provider. So why is it so important to engage them at the stage? It goes back to just with what I was saying earlier. You want to include them now. Allow their expertise with working with the community to come forward. So asking them, what are some of the outcomes that you're measuring now? Do you have the capacity to collect data for these outcomes? We'll be able to bring forth outcomes that are,
That slide advanced, but there's no,
oh my goodness, I'm not clicking it. I'm just going on.
we can hear you, but I wanted to make sure we're supposed to be seeing something we're not
You
seeing.
are. Thank you for stopping me. I saw that you.
It's probably because it's Zoom, and Zoom can
If
be
you want,
Zoom can be temperamental. So give me just a second.
my time is stopped, right?
Yes, it's okay, it's okay.
Okay. Now try to go to the next one and see if it works.
There
Yay.
we go.
Okay.
All
And
right.
apologies it doesn't all fit.
No problem.
The joys of the public library.
So this is all you missed. You just missed the beautiful slide of community engagement. So the first deliverable, as I mentioned, would be the key outcomes and measures deliverable. Again, I think some of my competitors might vouch to, will give you the outcomes with the associated priority areas, what we're saying. Let's bring in the providers, let's have a conversation with them. Let's share with them the outcomes and indicators that are used nationwide, and let's have a conversation. Does this work for you? Do you have the capacity to collect this data? We're going to continue with the community engagement with community forums. Again, this is by the sub-priority areas that you guys have identified. Once again, we're bringing them back. We're not just showing them the quantitative data that tells us what the needs are, but we're asking them, from your perception, from your experience working with your target population, what are the needs of the community? How do you see those needs in your community? What are the gaps in services? What are some services that you're able to provide? What are those services that you really could provide given funding, but you know your community needs it? We're also going to ask questions about what evidence-based or promising practices that they're currently using. Sometimes there might be promising practices that they're using that haven't yet been studied for efficacy. So we're here to listen to those. We're here to see how does that align with the current research nationwide. How are they dealing with the pandemic in providing services? How are they measuring impact? How do they determine what success is in their work? So I talked a little bit about how we're collecting a lot of qualitative data, and that qualitative data is just as important as the quantitative data. So in addition to collecting data from many of the sources that we outlined in our proposal, we're proposing to do a community-based assessment. This is to get more information by provider. What are their general operations? What are their target populations? All of this data is going to help feed into the comprehensive program inventory. So of course we can't do this work. Oh, there we go. I'm clicking it here thinking you guys can see it as well. So sorry. Okay, so 6 community forums. And then we have the community-based assessment. So since you guys did not see it, as I thought you did, it's asking questions about their general operations, what is their organizational type, what's their target population. This information will be important as you'll have a directory of the different providers and their target population. We'll ask what are their priority areas, what do they focus on, what funding streams are they currently tapping into right now. I know there's always concern about double dipping. Let's find out where are they currently getting their funding. Okay, here we are. So with the focus groups, I'm really excited about speaking with parents. And I say this to say that we, again, do this in a culturally responsive way. So we could tell parents, we'd like you to come over to our place to have a discussion about your needs. That is not our approach. Our approach is to ask for permission to enter their community, be in their space. So we could do focus groups, in a governmental entity, or as we've done in the past, we can go to their location, go to the sometimes we've gone to public housing locations, we've gone to churches, we've gone to gated communities to do these focus groups. The idea is that you're going to them, you're asking for permission to enter their community because they're sharing some information that is quite personal and sharing about their needs and their challenges. And so we want to put them in a position where they feel comfortable to do so, so that they can go before. We do our focus groups in the language that is preferable for the parents, so can be Spanish, can be Haitian Creole, can be Portuguese, it all depends on the population. Okay, so we do have our team members, and I'm hoping this is the moment where, if for a second, I really would like you guys to hear a little bit about what their roles are gonna be on this project, and what they're bringing. So we're gonna shift it over to you guys. I was so nervous that this wasn't gonna work. I'm happy that it's worked. Thumbs up to you, Holly.
I just wish that it wasn't so, like I could control it from over there, but I can't. So thanks for bearing with me. How do I make this part go away so it's full screen? There we go. Full screen.
Okay, go for it. Lexi, you gonna start first?
Absolutely. Hello, everyone. Again, my name is Dr. Lexi Balmer-Rivera, and I will be providing oversight of the research analysts and assistants, as well as quality assurance processes, including the final evaluation report submissions. I bring expertise in establishing evaluation procedures and creating relationships with community members and funders. And I will pass it over to Vivian.
Good morning, everyone. I am Vivian Borges, and I will be leading the funding options deliverable. I have expertise in equitable grant-making strategies and processes, strategic planning and partnerships, organizational development, and also leadership in both the public and nonprofit sectors, which will inform my work in this capacity. And I will pass it over to Gino.
Thank you. My name is Gino Rubens. I'll be assisting with the community programs inventory deliverable. I bring experience in data sourcing, entry, and management, as well as having experience in survey development, management, training, and administration in multiple languages for clients at the federal, local, and foundation levels. I could pass it to Kelly.
You're muted, Kelly. Hello, my name is Kelly Manning, and I will be showing me as I'm muted. Can you hear me now?
Yep, you're good.
Awesome. Sorry about that. Hello, my name is Kelly Manning, and I will be supporting the comprehensive program inventory deliverable. I bring expertise in managing databases, including for 250 international infrastructure projects for our U.S. Trade and Development Agency evaluation project, and 18 school program sites funded by the U.S. Department of Education. And I will throw it to Carla.
Thank you, Kelly. Hello, everyone. My name is Dr. Carla Rivera Torres, and I will be leading the informative programs inventory deliverable. I bring over 12 years of experience in research working with educational practitioners, students, and other related stakeholders. And I will pass it over to Dr. Patricia Warren.
Good morning, everyone. My name is Dr. Patricia Warren, and I will co-lead the disparities section of the gap analysis report and bring expertise in racial and ethnic disparities within the criminal justice system. I have more than 15 years of experience actually writing and publishing and studying disparities in the criminal justice system for both adults and for children. I'm currently leading a project where I'm exploring the school to prison pipeline. Most recently in 2016, I was awarded a grant with the Florida Department of Juvenile Justice to study disproportionate minority contact.
Good morning, everyone. I'm Dr. Stephen Ferrante. I have 38 years of experience in human service practice and administration across the lifespan, including extensively in child welfare. I've been involved in system of care design and evaluation, as well as strategic planning and organizational development. I'll be supporting facilitation of the community forums and development of the program's inventory. I'm going to pass it over to Ms. Crystal Lachey.
Hi, good morning, everyone. Thank you, Dr. Ferrante. I will lead the development of the databases for the comprehensive program and informative inventories. My 18 years of experience in leading enterprise applications and data management will inform my decisions and choices with this role. Thank you.
Good morning. My name is Robin McClyment, and I'm the Managing Director at QQ Research Consultants. For this project, I will be providing oversight over the subject matter experts. I bring well over 10 years of experience in management in the nonprofit and for-profit field, and I look forward to working with these professionals and serving CSC of Leon. Thank you.
And finally, I did want to introduce a team member who is not here today, which is Ms. Amanda Leher, who will be informing the theory of change model, as well as overseeing the facilitation of stakeholder-involved evaluation activities. She brings extensive experience in engaging community members and stakeholders in the research and evaluation process. Thank you.
Thank you. Have a long time. Okay, thank you.
Do you have anything else on your
I only
PowerPoint?
have like 2 more slides. I just
Okay.
wanted to make a comment about the proposed timeline.
You got it. I will put it back up.
Too many. Okay.
There you go. Back up.
Okay.
Oh, wait, I have to then click back into it. Oh, Zoom is so much fun. Edit that way. Yes. Now try. Yay.
Okay, and so we did take a look at the proposed timeline. We're asking if there's any flexibility just to give us just a little bit more time, even if it will take 3 weeks, a month, to be able to do some of that community engagement that I'm proposing. There is some recruitment that needs to happen to bring service providers and parents on board, so we feel like we just need a little bit more time. But we feel that we can be able to, I think we're hitting around April, June. So we're hoping there's some room to negotiate there. Here are our hours per deliverable. As you can see, the majority of the hours are in drafting the main deliverables.
Can I take a picture of that?
Yes, please.
All right.
And Holly, will you get a picture of the previous slide, please? I pulled up my phone, but I didn't get it in time.
Well, we know that that's all going to change now. Okay, we've also asked for us to think about the greatest perceived risk and how we would mitigate that. We do think that one of the risks is community buy-in. Knowing what we know about children's services councils throughout Florida, we've worked closely with some that we mentioned in Dade County and Broward County. There is a need for community buy-in. How do you do that? It's using the approaches that we talked about. Having them at the table, giving them some sense of decision-making power in some of these deliverables, letting them know that we care and we respect their expertise. Time is not on our side for this one, but that's okay. Being that we're a women-owned small business, we are very flexible and we're used to making modifications. Know that you will be able to reach me quickly. You will have my cell number. You don't have to go through chains to get to me. What I didn't mention, I don't want to forget that, is I am going to be serving as the program manager, principal investigator, because this needs to be a high priority project. And the last perceived risk is access to board members. I understand board members are very busy. We're hoping to start this process with the visioning session with the board members to set expectations. If we can't meet with the board members on a monthly basis, we're prepared to provide monthly reports and of course at the end. So this is my final spiel. So I'll just say again, why QQ? This is what we do. This is really what we do. We do county-wide assessments. We've done it in 7 to 8 different counties throughout Florida. We are experts in community engagement. We understand how CSCs work. We've worked for CSCs, doing technical assistance for providers, as well as at the executive level, as Vivian has shared. I thank you.
Thank you very much. I really appreciate it. And now we're going to go into a segment of questions and answers. I do have one question for you, and then I will gladly turn it over to the rest of the panel members. You said that you believe the time is one of the risks of this particular project, and you did graciously ask for additional time. You want time to meet which deliverable. So specifically, when we look at, that's why I wanted to go back to your deliverable slide. When you look at the deliverables, what time what deliverable do you need more time for?
Sure. What we were thinking was at the beginning, I think you guys wanted the key measures fairly early on. So we were trying to think about how would we engage the service providers that during that time. We're hitting Thanksgiving right before the holidays. So my thought was if we could potentially meet with them at the beginning of January, sort of set the stage, get the word out, meet with them then. I don't think it's gonna necessarily impact, I have to look back to seeing that first deliverable, if you guys wanted it.
Within 45 days is when we have the final key deliverables.
Yeah, so it would be the key outcome measures. That's what we're asking for, a little bit more time so that we can engage the community service providers.
Okay, and when you ask for a little bit more time, what is the time that you are requesting? So if the request is 45 days, when do you think your team can reasonably provide the key outcomes and measures after having done the community engagement at the level that you would like to do it?
I'm thinking around January, but I'm trying to count back to the days to see where that falls. 45 days, we're saying November, that's gonna be, so instead of mid-December, which I think around December, we're saying more like January. More like January.
So the middle of January instead of the middle of December.
Yeah.
So that's 75 days.
Yes.
Okay, thank you. That answers my specific question. Any other board members have any specific questions for Ms. Williams?
I'd like to ask, your team and you have a lot of experience in Florida. One of the things that we're interested in, I think, is a national perspective and best practices nationally. So could you address that and what perspective you bring and how you provide that?
Yes, I do want to share that. We do a lot of work in Florida. However, we have a number of contracts that's not just on a national level, but is worldwide. One of the examples that we provided was our work that we're doing with the United States Trade Agency, where they're looking to do evaluations. Over this year, we have over 125 evaluations that are done in different parts of the world. And so we're well connected with the work that's happening nationwide and outside of the US. And so whenever we're providing recommendations, we're looking at it really from a national perspective. Florida we can get great information in terms of, promising practices, but our goal is always to see what's happening at a national level. We have projects such as the Department of Education, where we're working on magnet programs and evaluating those projects using very advanced statistics. We're not giving recommendations for Florida, we're giving them recommendations nationwide in terms of what has worked. I do want to add that we have partnerships with other organizations that, as far as California, that we're working with. And so it's not just this small company just kind of thinking about what recommendations they can give, but this is through our partnerships with others. So yes, we do provide recommendations at a national level.
Good morning. Thank you for that response. You mentioned having experience with 7 to 8 CSCs or counties? Counties. Have you actually ever done a needs assessment for a CSC?
Yes, we have, and
could you be specific?
Absolutely.
With that experience?
Absolutely. So we were tasked to conduct a needs assessment focused on the special needs population within Broward County. So that was with CSC Broward County. I really encourage you to look at that report. I think we included it as part of our proposal. I feel we did a really exceptional job with that work, and it included engaging families, service providers, and so that was one of the, to be quite honest, once we did that work for them, Broward County also approached us, the Department of Human and Health Services, and wanted us to provide services for them after reading that report.
I have one more. I mentioned in the presentation, leader over, I guess it was Robin, SME oversight, subject matter expert oversight. What would be the role of the SMEs in this evaluation?
Sure. So with each subject matter experts, we really try to think of where do we need that expertise? So one thing that you'll hear from other consultants is they have consultants as well, but we're very intentional about where we bring them in. So we know we needed an expert in disproportionate minority contact, which is why we contacted and worked with Dr. Warren. Vivian worked for the trust as well as I did work for the trust at one point. And so she had the expertise of thinking through funding strategies. And I was excited because we were just on the same page when we talked about how do you have equitable funding strategies? What does that look like? So I'd love for her to share some of those thoughts with you guys, but that's how we were thinking about subject matter experts. When can we bring in? We don't have them full time because it would be quite expensive. However, we work very well with our subject matter experts and we use them in many, many different projects.
Okay, thank you very much for your presentation. As you, I'm sure, have probably determined that initial draft is very important to us, and we recognize the need for your request for an extension. But one of the major aspects of that initial draft with measurements and potential outcomes, based on your presentation, is your contact with various service providers in the area to get information from them. And my question is, have you experienced any reluctance of what do you use to engage those service providers from the standpoint of their being willing to engage with you so that you can collect that documentation for that initial draft?
Thank you for that question. So in working with grantees, one of the things that we do have a chance to do is to hear about their level of capacity. Many times we're coming in sort of representing the funder. We're not the funder, and we tell them that. We're contracted by the funder, and we share with them what our role is. But we do tell them, just to let you know, this is in no relation going to impede your ability to get funding. We're really just here to hear what is your capacity to be able to collect this data. And so we make sure we build that rapport because oftentimes they're nervous about sharing information about where they feel they are not as competent. But the thought is to make them feel comfortable, to hear about their level of capacity, and then to hear what the struggles are. Because many times I always tell them, you're in the business of providing services. That data and evaluation piece, that's sort of different. And that's where we come in as experts. And so we try to make them feel at ease and at comfort to know you're good at what you do, which is providing services.
Okay, thank you for that response. And just to follow up, how do you make a determination? Do you look at a percentage of the service providers to determine how many you need to contact, or to determine, I guess, whether or not the information that you're receiving is information that you can rely upon?
For which deliverable are you just talking about in general, like?
Their measurements and outcomes, their reports. In the Tallahassee area, we have many nonprofits that provide various services for our children and youth and adults as well. How does your company determine how many of those service providers to engage with?
Yeah, so this sort of goes back to, I still think it's related to equity because we want to allow everybody a chance to participate, right? And we don't want to say that, like for example, for the key outcomes and measures, we don't want to say, well, they don't have the capacity to understand evaluation, so therefore they can't participate. If you can articulate to me how you determine success, if you can articulate to me for your target population, how do you know you've done well for your participants, then you can participate in this conversation. They may not have the appropriate terms and terminology. However, if they can share, okay, well, when it comes time to just demonstrating that you did the work, do you use counts? Do you count how many people showed up to your events? Do you count how many people you provided tutoring services? Okay, now let's go a little bit further. How do you know if it made a difference? Like you could have provided all these services and then no one was better off because of it. And so we kind of walk them through that conversation because many times I'll find that some providers are really good at capturing counts. They can tell you how many, and then we say, but is anybody better off? You did all this, has anybody changed? And then they'll say, well, yeah, we believe they changed. Well, how do you know? What's your evidence? And that's where we kind of walk them through to think about it's more than just the counts.
Dr. Williams, thank you for your presentation today. One thing, as I look through the deliverables and everything that you all have said that you will provide, I don't want a bunch of reports at the end of this project. I'm not looking for, documents that's going to sit somewhere and nobody's going to do anything with it. I am looking for a resource that will paint a picture of every child in Leon County that is healthy, they are well educated, and they have strong family lives. That's what I want. And I want to know what services we have in place that's going to help them. And I want to know what's missing. And I want to know what we need to do to fill in those gaps. And I describe that as a jigsaw puzzle. I want a beautiful picture at the end. I want to know which puzzle pieces are there. And I want to know which pieces are missing for every single child, every different group in our community. How will you deliver something to me that I can use at the end of our work with you, outside of a report that I'm probably not going to read if it's really thick, something that's tangible that we can be active with and really have an impact in this community?
I so appreciate the comment because I hate for our reports to sit there and catch stuff. So no, we don't want to provide reports that are just heavy and thick with a lot of text. When we are completing our reports, we do want to make sure that it is in layman terms. I always say if my mom or grandma can pick up that report and understand what's in that report, then we have succeeded. And so I can't say that the reports are enough. That engagement piece, what we have done with some funders is kind of walk them through, okay, now that you have what you have, what can be the next steps that you can do as an organization to kind of move this work further? And so some of the counties, what they've done is what they call roadshows. They have, all the information we provided them, which includes many times a PowerPoint. We'll give them a PowerPoint with, some of the highlighted points. We'll have a discussion with them about, what can be some strategies that can be implemented, and we encourage them to still bring in community members for that conversation. So it's not just, okay, we know what we know and we're gonna decide on what the next move is, but we're bringing them in, and it could include parents, to say, okay, here's what we're thinking we're gonna do next. And so the idea is we try to leave you in a place that you know what to do next, how to move forward. We're not one of those companies that you call us back after we're done and we're gonna say, well, your billing hours are done. It's not gonna happen. Again, I give you my cell number because I want you to be able to call me and say, wait, we're thinking about this. We saw in something that you wrote, such and such, what does this mean? How do we operationalize that? So I say that I'm a partner, and once we become partners, we're partners for life. That's it. We're in it for the game, and it's not about the hours. And so I want to be able to let you know that we'll support you even after this work is done.
I think we have time for one more question.
Yes, we talked to 11, I think, people were involved in the engagement. Could you highlight for what you perceive to be the key staff that will be involved beginning to end that are critically necessary to be accessible to this project? I understand you're going to be the project lead, but I know there won't be 11 that are full-time. So can you highlight the core group or the core team that is going to manage this project?
Yeah, I would say in terms of managing and coordinating the different activities, we're going to have Miss Amanda here because we recognize that there's a lot of logistics that's involved in trying to plan community engagement. It's hard for me because I'm like, oh my gosh, everybody's important. And I think folks are coming in at different points of the process. So for example, when it comes time for the gap analysis, that's where we're really going to bring in Dr. Warren. We're going to bring in Elkin Alfred. We're going to bring in, I'm trying to think who else. We're going to bring in Dr. Flante for those pieces. When it comes time to develop a comprehensive program inventory, that's when you're going to see a lot of Kelly because she manages these databases. That's where you're going to see Miss Crystal Lachey, who's going to help us with the platform. So they're coming in at different points. The consistent thread in communication would be myself and would be Ms. Amanda here. So on a consistent basis, you'll see us.
And I'll just wrap it up with one quick comment. You said in the presentation that you need to get out to these groups to make sure they see the national data and do they have the capacity to collect it. To me, that's real important, capacity to collect data. What if they don't? How have you addressed communities who don't have the capacity to collect the data that we need to collect to get the results?
So the national data, the expectation is that we would be collecting the national data and sharing that with them. We'd also be collecting data for this county and sharing that with them. Now, in terms of their capacity to collect the data, we do a lot of capacity building and technical assistance for grantees. And what that looks like is actually going into their space, asking them, okay, let's see where you put the data. Show me the Excel spreadsheet you use. Sometimes they'll bring in a box and I'm like, okay, that's the data, that's great. Now we're gonna move this data over into a spreadsheet. So there are services that's really more geared towards building capacity of grantees. My thought is what can be done, and it's not in the proposal, what can be done is us providing them with sort of a training around what should be in place so that you can collect the data you need to tell your story, to measure your outcomes. And I think it's because that would need its own time and that would require training with them to do that.
I think we're out of time. Thank you very much for your time. We really appreciate it. Thank you very much for your team members that are virtually here in the room with us today. We are going to ask you to step out. We do plan to invite you back this afternoon, probably around 1 o'clock. Yeah, so stay in the area. You have a couple of hours to grab something, but thank you very much for your presentation. We appreciate your time.
Thank you so much.
Thank you.
We do, if you continue to talk, then make sure you use the microphone.
Yeah, members are about to say that this meeting is being recorded, so as we transition, we will be live throughout the day.
Thank you.
I'll be back here. Yes, perfect.
And for those of you who can see me and hear me, you can go ahead and leave. We're just going to leave the recording on for just a few more minutes in case there's a couple of additional discussions, but feel free to exit the room. Thank you.
Okay.
She's not gonna say.
Do you want me to break?
Are you guys ready? Do you, so the recording is on right now. If you want to have any comments amongst yourself for the sake of the recording, if you were to take a mental check out and go to the restroom, bathrooms are right around the corner. I just want to encourage you that do not discuss unless we're recording.
Yes, okay, so we are recording right now?
We are recording right now.
Okay.
And they're all gone, so they can't hear us.
I do think we're ready to go to the next group. Are y'all ready to go to the next group? Right.
So you want a bathroom break?
No, we're good. We're
No?
good.
Okay, I'm gonna restart the next room then.